This video will explain the information about deprescribing loop diuretics. So you're probably wondering, what is deprescribing? Deprescribing means lowering the dose or stopping a medication that may no longer be helping or may be causing harm. So why do we deprescribe in hemodialysis patients? Hemodialysis patients may take up to 12 medications each day. Also, since many medications are not studied in hemodialysis patients, the benefits and harms are unknown. Hemodialysis patients may also have a harder time getting rid of medications from their body, so patients may experience more side effects. What are loop diuretics? Loop diuretics are medications used to treat fluid overload from heart failure, liver disease, or kidney disease, or are used to manage high blood pressure. Some common examples include furosemide, also called Lasix, ethacrynic acid, and bumetanide. Now you may be wondering, why should you reduce or stop the dose of your loop diuretics? Since loop diuretics work on the kidney to have an effect, patients who are on hemodialysis and no longer produce much urine no longer have any beneficial effect from the loop diuretics. So we want to reduce or stop the dose of your loop diuretics. How do we do this? If you do not produce more than 1 cup of urine each day, you may be considered for the loop diuretics deprescribing trial. Your healthcare team will help decide the best way to reduce or stop your medication. This may include slowly reducing the dose you receive for a few weeks before stopping the medication altogether. There are a few things your healthcare team will monitor for after reducing the dose or stopping your medication, including any weight gain between hemodialysis sessions, your blood pressure, and the potassium levels in your blood. You may be wondering, what can you do if your high blood pressure continues after adjusting your medication? Your healthcare team may recommend starting a different medication for your blood pressure, such as Ramipril, or to return to your previous loop diuretic dose. There are also other ways you can manage your blood pressure. This includes decreasing the amount of sodium in your diet, for example through limiting pizza and canned goods, and by limiting your fluid and alcohol intake. You can speak to your dietitian to learn which foods are right for you. Overall, the goal of deprescribing is to lead to better patient care. Please contact your healthcare team before stopping or changing any medications.